Hello and welcome to Wave Clinical Support. I see from your clinical request you have a high myope who's monocular, who's previously worn multifocal lens, and you've recently switched to a wave lens and you're struggling a bit with getting optimum near vision. It looks like you're pretty close in your design and you're looking for some ideas on how to maybe get a little more reading out of this lens. Well, let's take a look at the design itself. Overall impression, I like your designs. It sounds like you're pretty close to being successful, but you're running into one of the clinical difficulties we all run into is how to get that little extra reading out of these lenses. So if we look at the design here for a moment, I know the first question you had was, should you go a little bit smaller? I know you brought that pupil diameter down a little bit. My impression with that is having one eye right at the pupil size, I'd be a little concerned about getting night glare. You might have to rely on your clinical impression on whether or not you can sneak that a little bit smaller, but I'd be a little hesitant to do that. I think right where you are is about as small as you're going to get away with this patient. I think more importantly, I'd probably look at the overall over-refraction. It'd be very helpful if you have the data of what their over-refraction was on their old multifocal lens to see if they were under minus than their old lens. That might give you a little idea of what you can get away with on the over-refraction. I noticed on the second design of yours you incorporated an over-refraction of -150. The first thing I would do is just see if there's any possible way to sneak any more plus on that overall lens. What I've tended to find with these multifocal lenses is the least minus or the most plus that you can get away with seems to do a better job of than just increasing the add in these patients. So the first thing I would do is see if there's any way to sneak a little more plus on this patient. If you can do that, I think that'll go a long way in improving that near vision. With that said, let's look at the add. The question you had was, should we increase the add a little bit higher? It seems like +50 more in the add area seem to help out, or should you just make it smaller? Well, if we're going to keep this pupil size smaller, I'd probably add the power. And one thing you can look at, if we look at the overall power effect, if we look at the central cornea, if we get in the central part of the lens, I mean, we have a minus power about 1688. And if we get out right here at the pupillary margin, you're at about 1566. And you'll notice if you add that over refraction in to 1375 and continue. If we come back here and now look at here, we're still at 1688 centrally, but now if we come here, we're only at 1543. So in effect, if you bring this back up to 1566, you've decreased that pupil zone already. So just by adding that over refraction in, you're effectively going to bring that pupil zone down a little bit. That's why I'd be a little hesitant to do it anyway. So I think if anything, I would probably, and of course this would be a little more aspheric through here in that transition of the power. So I'd probably go for number one, maximize the plus if you can, and then if you can't, add the over refraction. If you can, sneak a little extra quarter in the over refraction area here of plus. Then maybe only go up a quarter on here. And to be honest with you, there's not one set rule. You almost have to use a little bit of your gut instinct and your clinical impression and see what you can kind of push on this patient. And I would carefully go back and look at that old over refractive data to see if maybe the patient was under minus than the old lenses, and if you can somehow get a kind of a happy median, that 20 happy vision as we all talk about, I think you'll be successful. But I think you're on the right track. I know these are challenging cases, especially in the high powers. One thing I did want to point out, I noticed in your design, in your first design, if we bring that back up over here, if we get it to load up, I noticed that you had a central thickness of 0.2, and the new one you dropped down to 0.13. I suspect that probably happened when you added that over refraction data in. Sometimes that'll shift that down, so if you can get away with it, I'd probably make sure you watch that and try to get that a little bit bigger. As you know, if we get that a little bit higher, that'll help keep that lens stabilized so it's not rocking up and down. My guess is that was secondary to just adding that over refraction, so if you can do that, make sure you keep tabs on that. With that said, I think you should hopefully do well with this case, and I wish you well, and thank you for contacting clinical support. Have a great day.